Hello, my name is Derek Jorgensen, and this presentation is on patient counseling regarding new prescriptions. By the end of this session, participants should be able to use a structured framework to counsel a patient presenting to a pharmacy with a new prescription. So this is a scenario that most of you probably have been in before, at least as a patient. But since some students watching this presentation are early in your first year of the program, you may not have even experienced this as a patient. So I'll quickly walk through how this scenario typically unfolds in our health system in Canada. So let's pretend you get sick. Maybe you have a fever and you're coughing a lot and you have a sore chest. And so you go to your family doctor and you're diagnosed with pneumonia. So the doctor writes you a prescription for some antibiotics and you take it to your local community pharmacy to get the prescription filled. So when you walk up to the counter, probably the technician will greet you and you'll ask how long it will take to fill the prescription. And maybe she'll say 20 minutes. So then the technician will take the prescription and they'll fill it. And you'll come back maybe 20 minutes later to pick it up. Now the pharmacist has 5, maybe 7 minutes at the most to counsel you on the new prescription before he or she gives it out to you. So likely upwards of 80% of you will eventually work in a community pharmacy and spend a huge amount of your time counseling patients on new prescriptions. It is probably our single biggest opportunity to have a positive impact on patient outcomes. So it's really, really important that we do this well. The key message to keep in mind with respect to counseling patients about new prescriptions is that there are two primary goals that you're aiming to achieve. First, you're trying to gather a little bit of information from the patient to ensure that this new drug is going to be safe, effective, and that the patient's going to be able to adhere to it. And secondly, you're going to educate the patient about how to take the product properly and safely so that it works. Now, in some community pharmacies, part of the first gathering information step might be done by the technician or the assistant when the patient drops off the prescription, usually related to some basic information such as the patient name, their insurance information, and drug allergies. But in this scenario, we're going to approach this as if no information was collected at the time the prescription was dropped off. And when you meet with the patient to hand out the new prescription that's already been filled, you need to achieve both of these goals. And this is primarily because not all pharmacies collect information at the drop-off, and so you need to be prepared to do the entire process on your own when the patient comes to pick up the prescription after it's been filled. You might notice that this is not all that different from what we aim to achieve in the comprehensive interview, which was covered in a previous presentation. Except in this case, the information collection portion is focused only on one specific drug and one medical problem related to the new prescription that's being filled, as opposed to trying to collect an entire history of the patient's medical conditions and all of their medications during the comprehensive interview. So I'm going to propose to you to use a 5-step framework to complete this task in an efficient and complete manner, and I will walk you through this framework in the remainder of this short presentation. Now, a lot of the information that you'll need to collect to make this assessment will already be in the patient's computer profile in your pharmacy, assuming they are a returning patient to the pharmacy. There will also be a lot of information about the patient in our provincial electronic health databases regarding their prescription history at other pharmacies, lab results, hospitalization data, and so on. So you need to screen the patient profile and at times the electronic health viewer prior to talking to the patient to collect some information. For example, on your community pharmacy computer system, if they're a returning patient, you should have information about prescriptions they've had before at this pharmacy, as well as information about allergies and probably some notes from other pharmacists who filled previous prescriptions for this patient. So here is an example of the kinds of important information that you might be looking for when you search these databases before you talk to the patient and counsel them on the new prescription. For example, you might be thinking about, has this patient ever had this drug before? And if so, is there any documentation regarding how they tolerated it or how it worked? You might also be looking to see if there's any drug-drug interactions or contraindications with other medications on their profile or medical conditions that have been documented on the profile. You might also be taking a quick check to see if the dose on the prescription seems right for the patient's age, weight, or perhaps some lab tests that are relevant to the drug that you looked up on the eHealth viewer. Now, some of these may be very difficult questions for you to answer until you've learned a lot of information in your other courses about various medical conditions and how they are treated with drugs. Now, don't be concerned or overwhelmed because initially in the lab, we're focusing just on you learning how to collect important information. And later you will be asked to actually make assessments and decisions using the information that you're collected. And of course, you will usually be given time in the lab to look things up that you don't know or that you don't remember. So in step 2, it's time to meet the patient, talk to them, and counsel them on the prescription. So there are 2 quick things that you should always do when you first meet the patient to counsel them about the new prescription. First, it's absolutely mandatory to confirm the identity of the patient, as it's obviously a huge safety concern to accidentally give out the wrong medication to a patient. It's never good enough to simply confirm a patient's name. This is because there are obviously many sounded-like names out there that could lead a patient to accept a prescription that is actually meant for a different patient with a similar sounding name, and because patients can often be distracted when they're talking to you, and if you tell them, "Are you John Smith?" they might just say yes without even really listening to the name that you called out. This has happened in the past. So it's vital to confirm the patient's name along with at least one additional secondary identifier, such as their date of birth, their address, or their health services number. And in fact, the best way to ask this is really not to confirm any of this at all, but rather to ask the patient, what is your name, what is your date of birth, or what is your address, and then you can confirm it on the prescription. Next, it's important to take a few seconds to explain to the patient what you're about to do, particularly for patients who might never have had a prescription filled before and they don't really know what to expect. And so this can be as simple as saying something like, "I'd like to take a few minutes to ask you a couple of questions to ensure that this prescription is going to be safe and effective for you and to make sure that you know how to use it properly. Is that okay with you?" So in step 3, you will ask the patient a few questions to gather any additional information that was not available on your pharmacy computer system or the eHealth viewer, with the goal of collecting enough information to be able to assess that the prescription is going to be safe, likely effective, and able to be adhered to by the patient. So here's a list of some of the common questions that you'll usually need to ask the patient who's picking up a new prescription. Even if you have some of this information already on your computer profile, it's really important to ensure that the information is up to date and to confirm it with the patient. So you'll want to ask the patient if they've ever taken this medication before. You'll want to ask or confirm their medication allergy list that you have on your system, and you'll want to confirm their complete list of prescription, non-prescription, natural, and herbal medications. Fourth, you'll need to confirm a list of all their diagnoses or medical conditions. And finally, you want to confirm what the indication of the new prescription is for, unless it's obvious what it's for. So it's really vital to specifically ask about prescription, non-prescription, and natural or herbal medications as separate questions, since most patients will not mention non-prescription and natural or herbal medications if you simply ask them to tell you what medications they're taking. And then the final information that you'll need to collect is to get a brief description about the problem being treated by the new prescription. And again, the overall goal is to collect enough information to determine that the new prescription is going to be safe, effective, and likely adhered to. It's always useful to start off with an open-ended question and follow up with as many closed-ended questions as you need to fill in the gaps and get a decent history so you have enough information to determine that the new drug is going to be safe and effective. So you might ask a question such as, "Can you tell me a little bit more about your pneumonia?" Or, "Okay, so you've told me this prescription is for your sprained ankle. Can you tell me a little bit about what's going on with your ankle?" And then follow up with any closed-ended questions to get enough information to be confident in handing out the prescription. So after collecting all of this information, you'll need to think about what you've heard and think about the information you've collected and decide if what the patient has told you makes the new prescription potentially unsafe or potentially ineffective, or if you think the patient's unlikely to be able to adhere to it. And if any of these things apply, you're going to need to decide what to do next. Now, this is an assessment that is done generally in your head as you're talking to the patient. For example, perhaps you've determined that the patient has an allergy to the medication, or that the medication is contraindicated in this patient since it interacts with one of their other medical conditions that the patient just told you about. Let's say you're dispensing a beta blocker and the patient has severe asthma. Beta blockers can potentially exacerbate bronchospasm in patients with severe asthma. So in cases like this, you'd generally refuse to give out the prescription, and you'd need to contact the prescriber to probably change it. Sometimes you'll be able to fix the problem on your own without contacting a physician. For example, if perhaps you just need to tell the patient to space out the administration of this new medication with an existing medication to avoid a drug-drug interaction. And keep in mind, in the vast majority of new prescription counseling sessions, there are no problems that you'll find, and you'll be able to give out the prescription to the patient as it was written. So let's stop for a moment and discuss our expectations of particularly first-year students in Term 1. Because I suspect some of you who are listening to this are getting scared that you'll never be able to do this so early in the program. So we know that at this point you know almost nothing about therapeutics and drug information. Yeah. So we're not immediately going to expect you to make assessments of effectiveness and safety and adherence when you're practicing counseling in the lab. We do, however, expect that you'll be able to collect the information that was described on the previous slides and follow this framework with non-complex patients, regardless of not knowing much about the drugs or the diseases. And as you learn more about various therapeutic areas in your courses, we will slowly start expecting you to make these assessments on your own and intervene when necessary. And then the final step in this framework, assuming you've decided that it's safe to give the prescription out, you need to proceed to educate the patient about how to take the medication, with the overall goal of making sure they know what they're taking, making sure they know how to take it properly, and making sure they know what to expect after they start taking it. So in the next 2 slides, I'll summarize the key pieces of information that are often relevant and useful to educate a patient about. However, not all of the information that is on the subsequent slides will always be relevant for every patient and every drug. And the goal for you is to individualize the information that you're going to teach the patient. So here's a list of the common information that often will need to be discussed when you're educating the patient about a new prescription. You're always going to need to confirm the name of the drug and the directions on the label. And when you tell the patient how to take the drug, it needs to match the directions on the label exactly. You're not allowed to embellish or change them at all. If there are any special administration instructions with that drug, for example, that they need to take it with food or on an empty stomach or with a glass of milk, then you need to tell the patient. And this isn't always going to be applicable. There's lots of drugs where there are no special administration instructions, so you would skip this step. You are going to always need to confirm the indication of the drug, or simply tell the patient what it's for, and this can be as simple as, this drug is to treat high blood pressure. And then number 4, at times it's going to be important to expand on the indication of the drug and provide a little bit more detailed description of the clinical benefits of the drug, explaining in more detail exactly how it's going to benefit the patient. For example, in addition to telling the patient that this drug treats high blood pressure, you might go on to say that by lowering your blood pressure with this drug, there's evidence to show that it will reduce your risk of a stroke by more than 50%. Now, this won't always be relevant for especially drugs that are used for short term for really obvious indications such as a sprained ankle. So it may be enough to just tell the patient this drug is for the pain in their sprained ankle. But usually for especially chronic diseases, it's very useful to go on and provide the patient with more detail about how this drug is going to benefit their health in the long term. Fifth, it's important to explain to the patient when the drug will start working. Again, this may not always be applicable. Sixth, you always need to discuss a few important possible side effects. Usually we suggest narrowing it down to 2 or maybe 3 side effects that are most relevant to this patient. And that's the key when you look at the long list of side effects that a drug might have. It's important to pick out the more common side effects that might be relevant to the patient you're talking to. So for example, if the drug might cause weight gain in a person you know is trying to lose weight, then it might be a good one to tell them about. Number 7, you might want to explain strategies to manage the side effects if they occur. Again, this isn't always relevant depending on the side effects. 8, you may want to discuss relevant drug-drug or drug-food interactions. Again, this is often not going to be relevant. Number 9, you're certainly going to want to explain how to use a drug delivery device if you're dispensing one, and so this will only be relevant for inhalers or injections. You should always be discussing when the patient should seek assistance, and if there are any special storage instructions for the drug, then you should explain them. For example, does it need to be in the fridge? And for chronic medications that do need to be refilled, you need to explain to the patient how the refill procedure is going to work. And then just like in the comprehensive interview scenario, it's important to wrap up the session in a logical and organized manner. And there are generally 3 things that you might think about talking about when you're wrapping up or closing the new prescription counseling session. You may want to assess the patient's willingness or ability to take the medication as prescribed, although this may not always be relevant especially for something that is very short term that you're quite confident the patient is going to be willing to take. For example, something for pain for a sprained ankle. You may not be too worried that the patient's going to refuse to take it. But there may be cases where you want to double check that the patient's okay taking this medication. And you might say something like the quote on the slide here. You might say, now that you know all of this information, do you think that this is a medication that you're going to be willing and able to take? Secondly, you may want to summarize any important points. Again, if this were applicable, and usually it is. Usually there's a couple of key points that it can't hurt to reiterate. And then finally, you should always give the patient a chance for any final questions. So in summary, I've shared with you a 5-step framework for counseling a patient who presents to a community pharmacy with a new prescription, which includes some things you might do before you talk to the patient, opening the session, gathering some information to assess the new prescription, educating the patient how to take the medication, and finally closing up the session in a logical manner. And you will have many opportunities to practice this in the near future.